use our stretch tape around the muscles.
That's to set the anchor?
Yeah, for anchors.
Would you always use the heavy stretch tape, or would you use the...
Might use the light stretch. Either or is fine. This just happens to be the box that I grabbed today. So. That's the rationale behind it. Chances are, if you're working with amateur teams, you're going to be using the light stretch tape because that's what they can afford to buy. Anchor around the forearm.
She might mix some of that.
This is an area that we usually, especially with males, will pro wrap. We usually don't encourage them to shave their arms unless they really want to. But I'd be okay pro wrapping it. So, guys, you may want to pro wrap.
I was going to say, I'm not the Asian.
Not the squinty-eyed one. Huh? Was that what you were going to say?
No, Asian.
Okay.
Go with that. I don't like the dry. Yeah. What do you prefer? What do your people prefer?
Evan. I prefer to be called Evan.
You know it's just from me, right?
Pardon?
You know it's just from love.
Talking about my arms.
Right. So then the same thing. You're going to position the joint not at full extension but slight flexion because we're trying to limit that extension movement. And depending on the book or the reference that you look at, some will show the check rein, which is the X going across. Others, you can just do the straight strips that we did. Dave does the straight strips, just like we did for the back of the knee.
Yeah. Is it her arms supposed to be just slightly bent?
Just slightly bent, yeah. Again, you don't want too much because if we make it too tight, then functionally she's not going to be able to. It's like 10 degrees of flexion at the most, maybe a little bit less than that. So just so the joint isn't locked out, so just off of that locking position. Either would be acceptable for the exam, so whether you do it this way or the check rein, because you're going to very easily justify that what you're doing is trying to limit the extension movement, so your supporting straps will do that. And laying down anywhere from 3 to 5, 6 straps, depending on all of those same factors: size, whether or not they have guns or pipe cleaners, what sport are they playing, what position are they playing. Sometimes you may have to find a balance between stabilizing and allowing for mobility there as well. So that's when I get really picky with you. And same thing on 2 anchors.
This limits flexion?
Extension, hyper.
Yeah.
This doesn't work.
You're thinking to yourself, how in the world does that stop flexion?
Yeah, pretty much. Look, it's just gonna bend.
Okay, and same idea is we'll
Did you know?
secure these guys.
My flexion wasn't enough.
It was more like 1 degree. With the 10?
So she didn't maintain her position, so the reason this tape job didn't work is all her fault.
Isn't it the athletic trainer's job to ensure that the patient...
No, you tell them once and you say, if you don't listen to me and this doesn't work, it's your fault.
It's your fault. Just checking.
Is that actually what you say?
Yeah.
Oh, sweet.
Yeah.
Okay, so if we say that at the final? Then,
No, that won't be acceptable.
Okay.
Well, yes,
Yes.
clinically what I say. Yes, that is what I say clinically. That's not the right way to take. But no, I mean, you tell them how to position it. You indicate, like,
Mhm.
you need to maintain, if this is going to work, you need to maintain this position. I can't hold your limb in that position. So it's really important that you do this. Otherwise, this tape job's not going to be effective.
Mhm.
How common of an injury is that?
Hyperextension?